Good morning. My name is Hunter Myers, and I'm a medical student at Oklahoma State University's College of Osteopathic Medicine.
And I'm Courtney Mapes, and I'm a medical student at OSU as well. So our project is revolving around a hospital closure that occurred in March of 2016 in Tillman County when they closed their hospital Memorial. And so with this closure, they lost their maternal ward, their ICU, as well as their ER. And this came as a great loss to the county because it put them without a hospital within 31 miles. And so as a result of this, we wanted to implement telemedicine installments into the rural county ambulance services to communicate with OSU medical ER services. So as a result, we wanted to have objectives of analyzing paramedics' perspectives, as well as installing the functional unit to communicate with OSU Medical Center, and then also training the physicians and the paramedics in protocols and telemedicine technology. So Hunter had the opportunity to spend some time with Tillman County EMS services this summer. So he just wants to take a minute to visit on the materials and methods that he got to utilize.
So I am a rural scholar through OSU, and I spent 2 months over in Tillman County, Oklahoma, along with the rest of the rural scholar crew. And our primary purpose, or my team's primary purpose, was to conduct semi-structured interviews with the emergency medical services in both Frederick, which is the seat, and it is the county emergency medical services, and as well as the emergency medical crew in Granfield, Oklahoma. So we did a total of 12 interviews with 8 out of Frederick and 4 out of Granfield. Our secondary purpose was to observe the daily proceedings and interactions between emergency medical service crew members themselves, the community stakeholders, the patients they were seeing, and the transporting hospital.
So as a result of some of the conversations that were had this summer with paramedics and the EMS crew, there are some potential policy implications of effective patient care and efficiency of broadband. So if effective patient care, we're just looking at transparency between the receiving hospital as well as the paramedics to boost their competence, as well as the methods that they may be utilizing to make sure that they're bettering their methods and treatments. Additionally, we're looking at the efficiency of the broadband, which is a problem that plagues the rural Oklahoma. And so improving that across the state just to make sure that there's limited interruption when telemedicine is being performed.
So after conducting the interviews, we found that the crews were more than willing to participate and utilize telemedicine, and they had a lot of perceived benefits. This included increase in self-efficacy when making diagnosis and getting confirmation, getting second opinions on diagnoses of patients when they're making transport. The next piece is helping differentiate, so with more inexperienced or EMTs, differentiating between moderate and more emergent cases. Also helping with getting the patient to the appropriate facility, because if they're making an hour trip, it would be nice to get them to the right facility and the right care. And then lastly, the perceived benefits in patient education and when they do and do not need to go to the hospital. Despite these benefits, there were some perceived barriers. This included wanting to get hands-on training, not only during in-services at their base, but also in the field within their range of coverage, and also with more non-emergent cases with patients. As Courtney just mentioned, bandwidth is a great concern, making sure that they're getting connected and staying connected with the physician during transport, and also making sure that protocol is well established between themselves and the physician, and they're not being told anything they should not be doing, and that they're reporting appropriately to the physician. And then lastly, when it comes to the future use of telemedicine, how insurance reimbursement and disbursement is being appropriately managed between the transporting emergency medical crew and the physician.
So in conclusion, there is more research that is needed to overcome broadband access as well as adopting it into the community. But we are really enthusiastic, as the EMS crew was very optimistic about the telemedicine program that we're looking to implement. So moving forward, OSU Center for Rural Health and OSU Medicine is partnering with Tillman County EMS and AT&T FirstNet to launch this pilot in January of 2021 as we implement the telemedicine into the ambulances of the area.
So with all that said, we'd like to give a big shout out and recognize a long list of acknowledgments for helping us not only get established in Tillman County, but for making us feel very comfortable and welcomed and helping this process run very smoothly with conducting our research. We hope that this is not only beneficial to Southwest Oklahoma, but has greater implications for improving quality of care throughout the rest of Oklahoma. So we'd like to open it up to questions. Thank you very much. Boom.